Good morning, everyone, and welcome to this webinar. My name is Weeping. I hope that you can hear me loud and clear. We have about 198 participants in this room right now, and we are expecting more because about more than 400 has signed up, and I really hope to see all of them attending the webinar today. So today, this webinar is part of a webinar series brought to you by the National Council of Social Service, the Social Service Institute, as well as the Tamarack Institute. And myself, Weeping, will be moderating this webinar. Currently, I'm the Director of Services in NCSS. Collective impact is a model that NCSS is actively promoting the social service sector to adopt as a possible way for multi-sector partners to collaborate deeply in addressing issues that are complex in a more sustainable and effective way. This series of webinar is part of this effort to raise the knowledge of this model, going into the nuts and bolts of this model. And in addition, NCSS is really open and interested to consider ways to support the sector in doing collective impact. And this includes providing seed funding and matching partners around common issues. So, and we are very encouraged by the response to this first webinar of this series. We have over 400 participants, and they are from private foundations, public agencies, as well as social service agencies. So we have all the ingredients to form ecosystems around specific issues. So hence, throughout this webinar, I would like to encourage you to give us your questions in the web chat function, and as well share with us your experience of and an issue that you will be interested to apply the collective impact model on. And NCSS would like to get in touch with you if you would like to experiment with this. So without further ado, it is my pleasure to introduce our speaker today. I'll start with Paul Bond of the Tamarack Institute. Paul Bond is a global leader and an award-winning author on issues of community. His knowledge about collective impact and community engagement is extensive. Paul is also the co-founder and co-CEO of Tamarack Institute and the founder director of Vibrant Communities. This is a collective impact movement, including cities reducing poverty and cities deepening community, now active in over 400 cities using the collective impact and community development frameworks. And Paul is an author of 4 books, including 2 Canadian bestsellers. Paul is a senior Ashoka Fellow and an asset-based community development global faculty member. The Governor General recently inducted Paul into the Order of Canada in 2019. So I personally look forward to hearing from Paul, and I hope you do too. And without further ado, let me just pass this to Paul. Paul, over to you.
Lovely. Hi, everyone, and thanks so much, Weeping. It's been such a pleasure working with you and with your team putting this series together. I'm really grateful to the National Council of Social Service and the Social Service Institute for co-sponsoring this wonderful learning. As you know, it's a 4-part series. So that means that we are going to spend a lot of time together. We also had an intro to collective impact a few months ago, and we're going to be posting that for you so that you'll also, if you didn't catch the opening of what is collective impact, how does it work on a day-to-day basis, and then the marvelous questions that Weeping led us through and that you posted for us. All of that is on that video. And together, it'll be a 5-part series that you will be able to really engage in this type of work. You know, it's interesting. When I first thought about this idea of working collectively, we had just won an award from the United Nations as one of the 40 best practices in the world. And I thought that was such a strange thing that they would give us this award when poverty had actually gone up by 5% in our community. So we had done everything right. We ran this fabulous agency, did all this great work, but I was wondering, how do they give you an award when the problem is getting worse and not better? I don't know if you ever feel that way. You know, you're working at this, and yet you're helping people, you're doing good things, but the problem just seems to be getting worse, or at best, it's not getting better. So collective impact is really a way of rethinking, and maybe in some ways having us consider the challenge in front of us and getting to the root cause. Many of us are working, and particularly when we think about root cause, they're complex. Complex community problems such as poverty and literacy and access to housing, health or education, economic and social inclusion or immigration, they often have multiple interconnected root causes. So we're so used to providing services, and then what we find is that our services are becoming more and more specialized when maybe they should be more generic. Or at least at a minimum, that we're beginning to understand more deeply what's going on. Because you see, complex community issues are quite difficult to frame, which kind of means that, you know, there is no clear pathway to bringing new immigrants into our community and having them settle successfully. Every family is unique, right? You know, when we wanting to work in a low-income neighborhood, we have one low-income neighborhood and it's quite different than the other. And the issues and the problems in each one of them are different. So when we say that we want to tackle poverty or literacy, we have to actually put that into the context. But so often we want to frame it as if dealing with poverty or social inclusion is the same everywhere. And we want to come up with a solution that is the same everywhere. But then as soon as we do that, we come to realize that even different neighborhoods, different cities, the problem is framing and the causes of the problem, and in turn the solutions need to be customized. There's a lot of interconnected root causes that require interconnected responses. So as we get more specialized, thinking we're helping people more, we're actually, you know, creating a weaker solution. We've got to bring many stakeholders together to address the issue. We're operating in a dynamic and adaptive environment. So sometimes we bring a solution in and the problem switches on us. And as I've been sharing already, it's unique to the local context. I know that from our work in that opening story when we won this big award, the big question we were asking is, do we want to help those living in poverty live better lives, or do we want to end poverty? Our saying was, we want less poor, not better poor. And when you want less poor, you need to come up, it's a very complex problem, and you need to come up with a collective impact response. So we shared this with you at our last webinar, and many of you have read on collective impact, and here are the 5 key elements. First of all, we need to bring people together to develop a common agenda and a shared measurement. This is extremely important because what it's doing is it's sort of bringing the whole community system together to bear. And for us to be able to do more than just develop a plan, but to have a common commitment to solving the problem. Collective impact has a lot of reliance on good data, understanding data, really grappling with it. And the 2 I consider sisters, this common agenda and shared measurement, the ability to understand the problem, the ability to be committed to it together as a whole community, and then coming up with measures that we know that if those exist, we are making progress. Mutually reinforcing activities, just a kind of a way of describing how we're going to work together. Continuous communication, the sense that once we have a strong collective, we need to be thinking as one, we need to be learning, we need to be communicating with one another and growing in our knowledge together. And then the last part is this whole notion of a backbone support organization. Just like you need a contractor to build a condominium or a house, you need a group of people that are coordinating this collective effort. Those are the 5 key elements of collective impact. What we want to talk about today is this first phase. I'm looking at where I say the first 12 months, and really it takes us through these 3 phases. And I've got a diagram here that kind of looks at governance and infrastructure, strategic planning, community involvement, and evaluation and improvement. And it then shows you'll be getting these slides. It then shows the key activities that will occur. And so really, as you can see, phase 4 here is about implementing the plan. There's a lot of independent work that needs to be done in the first 12 months. And that's what I'm going to be taking you through, maybe in a little bit easier to understand. But you'll have this chart, which is nice to show people in terms of what is the work that we're doing and what it requires. I don't know if any of you have seen this. It's kind of like the forward and backward loop and then the productive loop. And so what we're talking about here is when a project reaches maturity, it often has to reinvent itself. And here we are in the reinvention phase. We call it the exploration phase, and you see it here in a red box. And that's when new thinking starts to emerge. We expand possibilities and buy-in. We start to make choices about what might have the biggest outcome. And we birth new ideas, we develop and adapt them, we refine them, and then we start to grow them. It's kind of this whole developmental phase, as we call it. And that is the first 12 months as we're starting to implement a new idea and project. But what's just as important as the idea and the thinking and the plan is the bringing together of people, so that we're developing a common agenda where there is a role for the business community, a role for government, a role for the community sector, and a role for the people we're trying to help. And so if we're helping people living in poverty, there's a role for people living in poverty to give leadership. If we're working with new Singaporeans, I don't know, we always call them new Canadians here, there's a role for them to provide leadership and give us input and to work together, that citizen kind of action. So in these first 12 months though, it's more than activities. What we're also doing is we're starting to change the way that people think. We're sort of tackling culture. Because, as much as we want to do activity, you've probably heard the saying, culture eats strategy for breakfast. The popular saying in Canada. So what it means is that we really need to start to figure out, how do we change the way that people think? How do they begin to really understand this work differently? And so we're wanting to change people thinking sort of incremental change, right? We're going to help people, give them a little bit more food, give them a better place to live, help them get better access to transportation, rather than sort of transformational change thinking, which is like, why is it that people don't have enough, right? And how do we begin to give them enough so that they're able to act on their own? It's kind of that way of beginning to understand the problem from a new angle. It's also about catalyzing collective leadership. It's not just about one agency doing its specialized work. It's about us starting to think as a system and work together as a system and plan together as a whole. And then our work here in this early phase of gathering people together is really to help system leaders. That means all the different players from business, government, the community that we've involved, is help them understand the greater system and the complexity of which they are part of, right? To just help them understand the whole picture about the problem that we're dealing with. We want to foster a different, deeper type of dialogue that leads to greater clarity, understanding of difference, and that leads to innovation. And we want to start to shift the collective focus from reactive problem solving to co-creating the future. Really, there are 5 shifts in perspective that we often talk about to try to move people from thinking about the problem. You know, the problem is that we have too many low-income people that are from outside our country, too many immigrants, rather than saying, what are the assets that they bring? How do we actually begin to think about this as an asset-based solution and look at all the things that are going well for us in Singapore and asking, how do we begin to apply those to the few problems that we have? We want to shift, we want to start to put trust and relationships at the center of our work. We want to shift to data that everyone understands. We want to shift the energy, knowing who and what to emphasize in the work. And we want to start finding the blind spots that are keeping us from coming up with new solutions. All of this in the early phases of our 12-month journey. And so we begin as we move forward. And I want to take you through a couple of slides. And I kind of thought to myself, okay, well, how do we operate? My board chair asks, why a collective impact? What will we achieve in the first year? In this case, it's probably Wee Peng asking me this. He's asked me this many times. What will we actually achieve? And why is this worthwhile, right? Well, part of a 12-month journey is we need the time to collectively understand the issue and to commit to the change we need and to generate a collective action toward that change. So that's why I always like to say that the first year of collective impact is very critical, because it really helps us to understand the issue in a different way and generate a collective action toward that change. That's the difference. It's not just coming up with a great plan, a great new idea. It's about coming up with a new idea in a way that we all want to do something about it. So I say to my board chair, after the first year, here's what we want to accomplish. We first of all want to build the community will to address the issue. So if the issue is social inclusion, how do we get that to become a priority of the neighborhood we want to work in or the city we want to work in? So at the end of 1 year, we're going to go from people kind of being interested to there being a real momentum around this change. We want to draft a plan together. We want to formalize the network that will adopt and implement the plan, right? The network of agencies and people that are going to implement the plan. And we're not just going to do that. We're also going to organize in a way that we're going to practice working together. We're going to agree on a governance model that will make the plan live. And we're going to raise the funds to implement the plan. So that's our first 12 months. In addition to that, we want to build our team. We want to engage a small team of people that we trust. We're going to build trust with them. We're going to ask what's the change that we want to see. We want to map the system that we want to engage. And we're going to invite system leaders to join our group. So we're going to start by building a larger team finding out who in the community cares and bringing them together. As you can see here, we're going to build a lot of trust. That's key in the first year. We're going to really keep track of everyone that cares. We're going to build a database. We're going to start a direct mail process so we can communicate with them on a continuous basis. And then when people are inspired to act, we're going to encourage them. We're going to help them. We're going to share what they do with everyone. And in that, we're going to build momentum, and we're going to get people to feel like at the end of 12 months, something is possible that they didn't think was possible. We're working on ideas we hadn't thought of before, and we're starting to make a difference. I think of Des Moines, Iowa in the first year when I was working with them. The first thing we did was identify the top people. We call them the top 100 people in our city that if they were engaged, we know things would change. And we invited them to a 2-day event. They all came. Very remarkable. And we spent 2 days talking together, learning together, brainstorming together. And out of that, we developed a leadership roundtable that was made up of equal parts business, government, voluntary sector, and people with lived experience. We developed a listening team that then went out into all through the central Iowa region of Des Moines and listened to people's stories about what was keeping them from advancing, what was keeping them from bringing about the life that they wanted. We developed a data team that really began to look at the numbers, what was really happening with people, particularly people who were living in poverty, and trying to understand how we might move them forward and really understand what was causing their issues. And then we developed a set of action teams that started practicing and working on this. And at the end of a year, through all of that, we not only came up with a marvelous plan called Opportunities Central Iowa, but we also raised the money we needed to implement that plan. And when we launched the plan, there was 182 individual organizations and corporations in the room, all of them endorsing the plan, all of them committing to implementing the plan together. And it didn't take long. Within 3 years, Central Iowa had impacted where over 25,000 families were now economically self-sufficient that were not 3 years earlier. A tremendous impact. Never seen movement like that before. Here's another way of looking at the first 12 months. It's a place called Chatham, Kent. And you sort of look at this plan in the first 7 months, organizing an early engagement, kind of working with people, right? People becoming engaged, holding their first major event, right? Working with people's feedback and sort of reorganizing, expanding their engagement, again with their feedback, and then a launch through that period. They just launched this year. So there's so many different things that we can sort of talk about in this first year, and understanding that when we work together and we truly understand what we each want and what the needs are, we can build a coalition, a collective. And together, when we are working together, we are going to make a bigger difference. I wanted to just end by sharing a couple of ideas that arise, and soon we're going to get into the question and answer period, and we're going to look at some of the very detailed specifics, but I wanted to give you this background. I'm not sure if it's as popular as it is here in Canada, but the word emergence has really dominated social services and community development. It's this understanding that if we enter into an issue, we begin to understand it uniquely. And as we understand more, we engage more deeply. And so our ideas are constantly evolving. And as our ideas are evolving and our relationships are evolving, we are able to, and as we call, enter into the system that desires change. And we're able to move with it rather than trying to control it. It's kind of a very interesting concept that I would suggest that if you're interested in collective impact, that you spend more time thinking about and working on. Many people ask in this first 12 months, how does the backbone role grow? And again, here's just some ideas, but it kind of works this way. You know, it's like an individual convenes a discussion. A small team leads the exploration. Most are paid by their organizations. They're not paid staff of this group. And they give of their time. They start to, everyone that's kind of concerned or interested in the issue. They form a leadership roundtable. They'll probably hire a few staff at that point. And most often they're supported or sponsored by a strong organization with charitable status, one that can receive gifts and donations and manage money. There's a lot of engagement work in the first year, and we talk a lot about developing a strategy, an engagement strategy that that helps us to really reach out and build momentum. Continuous communication is a huge part of collective impact, but you can see in order to build momentum, we got to talk to each other. We need to share understanding. When data comes our way, when knowledge comes our way, we need to be able to share it in a way that people understand it, and build a database of names of people who care. All of that in the pursuit of building momentum. And ultimately, we want to end the year with a community plan that everybody adopts, is excited about, and is ready to move forward on. So Weepeng, that's my part of the presentation. It's just a quick background to the first 12 months. I know that we're now going to hear a dynamic case study, and then we're going to move into the question and answer period. So I'm going to pass it back to you, and hope that works well.
Thank you, Paul. And many questions has come in response to your sharing. I suppose you have given us a background teaser for us to think about it and then ask questions. More will be discussed during the Q&A session and dialogue session. So I would now like to invite Kevin, our next speaker. And Kevin and I got in touch after the webinar that we organized in May about collective impact. And we had a discussion, basically had a chat, and I was really fascinated by the approach that he had intentionally adopted to develop the capacity of local community to care for seniors with dementia. And the approach really emphasized on community development and forming partnership among social service agencies in that local community. And Kevin believes that the project has not reached the state of collective impact, but he's eager to know how he could apply this model. But I believe that he has already gotten some element of collective impact into the project. So without further ado, I'll just introduce Kevin, and for himself to give a short introduction about his work with Touch Community. Yeah, Kevin, please, over to you.
Hi, morning everyone. Can everyone hear me okay? Yeah, okay. I'm just going to dive into the slides so that we can get straight to the topic. Yep, great. Okay. Yeah, once again, thank you for having me on this webinar. It's been interesting in the conversations that we've had with Weepeng and SDSS, and we never thought we'd get a chance to share about this, but the journey that we took, you know, to enable community resources to become a part of the solution. And it's been a journey that started almost 4 years ago for us in Ang Mo Kio, with Touch Community Services establishing our home care services in that town. So I'm going to begin with an introduction about who the organization is, because I don't think everybody knows who we are. So we are a not-for-profit charity. It's been around since the late 80s, and we became a member of NCSS in 94. It's been an interesting journey for us as we grew over the years to include services that serve the very young to the very old. And last year we had the opportunity to support about close to 200,000 people in Singapore through the different services. We've currently got about I'd say 21 services across the 4 different segments of this life journey that you see, where we try to bring together different expertise and people in different locations to support the community through these 4 causes. For us, I sit within the elderly cluster, but I also try to head up community enablement, where we want to look into how our services can continue to stay relevant in the context of a changing demographic. I think most of you would know that Singapore is an aging community. I know we've got some guests from Canada. Just to give a bit of a background, Singapore is one of the faster aging communities in the world. And there's been talk and studies about how we might even supersede Japan by 2050. So this is an issue that the government's very concerned about, and those of us serving the older people in community are very concerned about. How are we going to be able to sustain our level of support and just continue to keep older people engaged, living independently, and what we commonly call aging in place or aging in community. So about 5 years ago, we started looking at this issue in earnest, and we decided to start with a particular location where we were already a community stakeholder, and that's in Ang Mo Kio. For those of you who don't know, Ang Mo Kio is one of, it's a town in Singapore. I know Singapore is not very big, it's an island, but we have got different townships across Singapore. And we, carved out these 32 blocks of apartments with about 12,000 residents. And we then found out that there are about 3,000 who are above the age of 60 to see how we can journey with the residents. We want the residents to become a part of the solution. We want to see the community assets included in solutioning. We want to see how communities of care, networks can be formed, not just links to formal service providers, but also links in the neighborhood between neighbors, where they can be activated and they will feel confident to become a part of the solution. I think we're familiar, with the conditions, with the culture, with the environment in the apartments. These days it's often closed doors, after we get home, and everyone's trying to find their own space, just to chill and to cool off after a hard day's work. And that doesn't quite add to the vibrancy and the life in a community. So we've kept to our own, and but yet we know that there are lots of pockets of engaged residents. We've got the volunteers in community, and we want to see how we can pull this together and make that community a little bit more vibrant and more independent and interdependent. So we set up different activities, we set up different platforms. As you can see from these photos, we've got interest-based activities, be it music or learning more about their smartphones. We've got people who come together to just have a chat We've also got people with needs that come along and are supported by our volunteers and our staff. We've got a community hub that we call Touchpoint in this community. So we work both in the common areas of the community as well as a focalized hub where we are able to engage them perhaps with more intensive coaching and training. So it's something that we are proud about, but I'm just going to let the residents speak about their experiences with this project that we've had, the Community Enablement Project. Okay, sorry. I'm just going to play this video. It's going to be a little bit soft at first, but the volume does get a bit louder. So perhaps turn up the volume on your laptop so you can hear a little bit better, but there are captions to this video. Okay, where did that cursor go?
Hey, 我是苏珍，我住在这里应该有30几年了。我希望我接下来的30年还能够住在红帽桥养老。
My name is Saraswati. I stay in Tokyo 41 years.
我是周秀英，今年78岁。我是廖家南，今年76岁，住在红帽桥。我们在这边住了23年了。
对，你们很有爱心啊，很照顾老人家一辈的，好像不能怎么行动，做 exercise 的时候，我看到的是你们去怎么样帮助他exercise。
I saw the paper here, my house, that time 2 years ago. Then I saw, then first I got registered, then I joined. My body was so very active, but no cholesterol now. Last time high cholesterol. Now no cholesterol. No, I didn't take medicine. Then my blood pressure was under control.
人生就是很短，但我们走到今天，已经可以放下东西的话，为什么我不要走出去帮助人家？其实我们现在，这个年龄应该要做一点有意义的东西。
有力量的人就可以尽量出来帮忙啦。
你整天躲在家里，除了吃人，帮忙一下，可以是多一点。
鼓励他们出来，大家帮忙就比较好一点啦。因为人手多，办事就好办了。
Last time, very boring. Now, go exercise. Got so many friends. The Chinese are very good. Chinese friends, Indian friends, got Malay also. I want to go I get old also. I stay here. Confident. Stay here.
Thank you. Okay. As you can see from the video, the approach that we took for community enablement is about getting people connected. You know, we found that when they were able to have an opportunity to interact and talk to each other, you know, it kept them happy. And it was also because when we did the exercises and all, it addressed different realms of their wellness, you know. So it's not just the physical wellness that we focused on, but social wellness, you know, emotional wellness. We looked at quite a few different platforms so that we keep them happy, we keep them healthy. But the other bit that we felt would give us a more enabled community would be having them come onto platforms where they are able to contribute. You know, there is this notion that, you know, as we get older, we tend to get less involved. But I think if you look at the new old, all right, you know, and I'm going to get there in a couple of years, you have a lot of professionals who are retired or retiring, a lot of people who have been active for a lot of their lives that can continue to contribute and want to contribute. And I think that's when, you know, they feel a lot more fulfilled. They feel a sense of belonging and, you know, a need. So this is the approach that we've taken in the last couple of years. And we're happy to say that, you know, we're seeing networks being formed. We're seeing, you know, in the past, we used to have to organize outings to get everybody going, you know, enjoying time with one another. But these days, we're seeing residents themselves initiating these activities, these programs. We've got Mr. Lee, a 72-year-old gentleman in the neighborhood who comes to Touchpoint every Tuesday afternoon. Of course, this is pre-COVID-19 season, to share about calligraphy. And he's got his students, you know, about 20 plus residents who come along every Tuesday to practice calligraphy. And because they have an interest in it, and then just to share and talk, you know, and in doing so, create new relationships and create new networks. So it's the people that we focus on, but we are also cognizant that the infrastructure and technology are key components to this approach. These are key tenets that affect mobility, they affect accessibility, and we do have platforms with regards to these two key tenets that we work on too, but I'm not going to talk too much about that today. I've got this slide up, you know, to continuously remind ourselves that this effort that we take in Ang Mo Kio for our community enablement project would not have been possible without the partnership of these organizations whose logos you see here. It's been key having them on board, working with us to share, to develop different programs and platforms, not to mention the volunteers that we get from the organizations as well as the community. So these linkages that we form have been very key, and not to mention also the financial support that we've gotten from these organizations. Now, Touch is mainly, I'd say, a home care provider in Ang Mo Kio. We provide our services, home-based services, so that older people can continue to stay at home with the appropriate nursing, therapy, housekeeping support, you know. So we provide this support, and we've come into contact with a lot of clients beyond the community enablement precinct. And we realized that, you know, there was a lot of confusion, you know, sometimes about, particularly with the older people, about what support is available in community. And so this got me and a couple of people talking in Ang Mo Kio. And at that point in time, it was mainly AMKFSC, Community Services, AWAR, and National Healthcare Group. You know, it was just the four of us sat down and we started talking about how we could come together to provide a more coordinated support to the resident that would, you know, not overwhelm them, not burden them, but and to also help people access the services. So 4 years ago, we came together and said, hey, let's start looking at who's first in to that household, and then how the rest of us can come alongside to support this person. And that's how the Amokyo Partners Network started. But you know, the challenge is, oh, sorry, I left out this slide. Before I go into the Amokyo Partners Network, some of the principles that we adopted in building Enable Community is now available in a handbook that the Agency for Integrated Care compiled. So this is something that's available on the website. For the other platforms that I shared about within for CEP, you can also find it on our website under the Community Enablement Project. And because of COVID-19, we've also started this platform called Touchpoint News, where we share online resources in the different categories that residents have expressed interest in, where they can access because they're largely home and they're largely keeping themselves safe from the virus. Although I'm glad to say that things are easing up now. Okay, so just to go back to where I was before, you know, it's really about establishing trust within the different organizations and sharing what we have, the resources that we have within Amokyo that started the Partners Network. We're glad to say that since you know, we've started this, about 24 organizations have come for the meetings. It was really about, we didn't have very much to start with, but we just wanted to know who amongst us, which community stakeholders in Amokyo were keen to come alongside that agenda to provide more coordinated services. As you can see from the list, it goes beyond community service organizations, it goes beyond healthcare organizations to the grassroots committees and even the certain stat boards that are represented in town. And we got them together every quarter so that we can have tea, you know, have a tea break, and then start talking about what each other was doing in the community. We had an average of about 40 to 50 people every session, and we took turns to host the meetings at the different locations within Amokyo. So this made it very, you know, relaxed. We had a very relaxed environment, and we started talking about not just the services, but about the different communities that they're serving within Amokyo. And I think what struck me about Paul's presentation earlier was how it's a common feature in Singapore here too, you know, that where people in different parts of Amokyo had different issues and different profiles. So we had to kind of put our heads together to talk about how we were going to address the issues across the town. And in doing so, come together with a more coordinated approach. Yeah. In talking about all those services along the way, you know, we struggled with how to find common ground, because as most of us are familiar in this webinar, we are set up to achieve different objectives. You know, we all have so much to do in the different areas that we're focused on, be it the youth, be it the children, the elderly, and then not to mention the different areas within each of these focus groups. So it was a challenge for us, you know, to come together and say, hey, is there something that we can do together? Because we're set up to do different things, we're funded to do different things, and we all have different management to report to, different boards to report to. So we got, you know, we just started talking and talking until we came to a point where we realized that quite a few of us were talking about dementia as an issue across the different stakeholders. And that's when we started looking at seeing if it was possible for us to build on this common challenge across the neighborhoods in Amokyo. And that's where we hit upon the idea of promoting an inclusive and dementia-friendly community in Amokyo. So this started about, I'd say a year and a half ago. right now. And we got, the planning committee together. That's about 5 or 6 of us that usually comes together from the different organizations to see what were the activities that we were already doing that we could leverage on, each other could leverage on, because the residents came from different parts of town, and we wanted to make sure that no one fell through the gap. We started to look at what were the things we could possibly look at as indicators to see how, where they are now, where they want to go, and whether we're really getting there. So we did this, and we are glad to say that, we started several walking groups in Ang Mo Kio in different constituencies. We launched that in September last year. These are some of the photos of that walking group. So we had this Orange Brigade going through town, and that attracted a lot of attention. And people started asking about what this was about and if they could join in, because walking as a regular activity and walking with the loved ones was one way to prevent and delay dementia. We had about, I think, 120 people. And we even managed to involve one of our other partners, the residents of a nursing home in that community, and brought them along for the walk. And it was really a joy, where we culminated it in a community walk at the Bishan Ang Mo Kio Park, with about 400 plus residents coming along. And we had about 14 organizations and grassroots organizations coming along to support us. So Walk to Remember is now a program that we're going to continue to support in Ang Mo Kio across the different communities. And we've started talking about how we needed to formalize some of the work, how we're going to continue to share resources, share activities on a common platform. Okay, it's been a tough journey, but at this point, we have now got some common funding and also a committee set up with the leads that you see there on the slide, where we have established what are the areas we want to work on. And really, it's about preventing frailty and delaying dementia, so that the older people in Ang Mo Kio can continue to do what they enjoy doing, and continue to be a source of help in the community to one another. And we're extending this from the work that we do in Community Enablement Project, where each activity is a platform for us to continue to connect people and continue to help them see the areas of strength. But one of the key things that we found was something that we needed to spend a lot of time on, not just with the residents, but even amongst organizations, was really about building trust. We really needed to help one another see that, hey, we're all in this together, and support one another, so that in the longer run, we're able to meet the deficits that we're going to see come along from an aging community with a shrinking human resource base. We've got a plan moving ahead on how we want to target people who are well to those who are in the late stage of dementia, where we probably can't do as much in the community for the people who are have severe dementia, but we can support caregivers, and provide a peer-to-peer support, organize these different platforms to keep the neighborhood safe, to keep the neighborhood activated. We recently had a survey, a quick survey done in Chengshan and Teki constituency with the dementia attitude scale. We found that people are generally positive to people living with dementia, but the level of knowledge and is actually low, as in how they should interact and how they can support. So we've prepared, we're looking ahead to a series of webinars that we're preparing, and that would be hosted on a common website, and where we're going to share more about how we're going to promote awareness, how we're going to promote simple support and intervention, and where the resource points are across Ang Mo Kio, and then continue to highlight the need for us to be involved as a community within Ang Mo Kio. So that brings me to the end of my sharing on how we've been trying to build community assets and networks within Ang Mo Kio. And for Touch, it is an ongoing work because community enablement we see is part of our vision about building strong families, caring generations, and enabled communities. And we're trying to pull together the different services within Touch so that we can provide a more integrated approach to the issues in Singapore and in the communities that we serve. Thank you very much.
Thank you, Kevin, for the sharing. What struck me in Kevin's sharing is the, how community development and collective impact sort of come together at some point of time as an intersection where, after you have built the assets within a community, the next step is to get people to work together collectively to address the issue at a systems level. And I see that as something that Touch and their partners are currently working on. How do we define inclusive community for dementia? Apart from the agencies, whether the service users, the people living with dementia, whether they get to have a chance to participate in the agenda building. I think those are some questions that also came out in the chat group, and I hope that Kevin could answer some of these questions at the next segment of our program. Okay, so we are going to go into a dialogue session with the speakers, and before that, I just want to introduce Liz Weaver, who will participate in the panel as well. And Liz is the co-CEO of Tamarack Institute, where she's leading the Tamarack Learning Center. And she is well known for her thought leadership on collective impact, and is author of several popular academic papers on the topic of collective impact. She is the co-catalyst partner with the Collective Impact Forum. In 2018, she led a collective impact capacity building strategy with the Ontario Trident Foundation. She is passionate about the power and potential of communities getting to impact on complex issues. Prior to her current role in Tamarack, Liz led the Vibrant Communities Canada team. This is almost, I think, if I'm not wrong, the biggest collective impact movement in the world, and assisted place-based collaborative tables develop their frameworks of change and supported and guided their projects throughout from idea to the impact stage. So really very happy to have Liz in our panel today. And without further ado, I will move on to this segment to ask them some of this burning question that came through the chat. All right. Okay. So one of the things that came, common questions, maybe this I'll address to Paul. I'll frame it this way. As a social service agency, I mean, you are one among many peers, right? How do you get it started? How do you start a collective impact initiative? Having to convince people, how do you convene the dialogue, and how do you arrive at the agenda, the common agenda? So perhaps the nuts and bolts of this, Paul.
Well, let's let Liz jump in on that one. She's got lots of on the ground experience.
Sure, Liz, I mean, go ahead.
You're on mute, Liz.
Yeah, you're on mute, Liz, yes. And would you want to talk a bit about yourself?
Yeah, I think it's interesting, right? Because as Paul mentioned in his presentation with the Des Moines example, it started with conversations, right? And I think that that's often when we look at and support collective impact work in communities, it's usually one or two or maybe more organizations that say, here's an issue that we're interested in. And that group gets together and they say, hey, would collective impact help us advance the issue? So it starts usually in a small conversation, and then you begin to kind of spread the circle a little bit wider, and you think about who else should be involved in this conversation. From there, you begin to say, okay, so what do we currently know about the problem? And I think, Kelvin, your example was really interesting, right? Because you had a core group of 6 people, but then you brought more and more organizations to the table in Canada, we would also bring people who are directly affected by the issue to the table as well. And so it's through that kind of conversation. What's our shared understanding of dementia or wellness or poverty reduction? How do we all kind of understand it? What's our experience with it? And then we add in the piece around data. And what is the data in our community that tells us a little bit more than our shared or personal experience with the issue? How does the data help inform our conversation? And I think it's kind of like these continuous circles of conversations that you have, informed by personal experience, informed by data, and then you go to what is it that we want to do together. And that, I think, Paul, as I was listening to your presentation, that's kind of the initial process that a lot of communities go through. They get a few people together, they share their experiences, they identify some other people to bring to the table, and then they start to get to that kind of common understanding of the problem or the opportunity that they are seeking to shift, and then really kind of beginning to say, okay, so then what do we want to do together?
That's good. Just to add to that, Liz, I don't know if it's the same here in Singapore as we have in Canada, but we have a lot of collaboration in Canada. That's been about 10 years now, where even funders have required collaboration in order to get funding. But people have gotten very tired of collaborating because they're saying we're collaborating for what? There's no good result, right? And so often these collective impact tables form out of existing collaborations. They want to do more. And so they're already formed in some senses, or at least the catalyst is there. They need to expand it and make it multi-sectoral. I think it's probably quite similar here, in Singapore, where there's lots of collaboration already on issues and in communities. And maybe they're feeling tired of collaborating because it's a lot of work and they're not getting anything done. So when they want to get things done, now they move to collective impact.
You're right, Paul. I mean, there's no lack of collaboration, but it's exactly the point. How do we bring a group of people, agencies that are involved in loose collaboration, perhaps it's more transactional, on a case basis, to work together collectively to address the issue at a systems level?
You just named it. You just named it, and that's really the problem that we're trying to overcome. Yeah.
Yes, and how do you? Okay, so sounds simple, you come together, have conversation, but how is it facilitated? Do you need a neutral agency to do this, or actually among the peers, you can engage such conversation through certain framework or certain skills? What is involved? I mean, it sounds easy, but I don't think it's that simple. So just want to hear the lowdown of that.
I think there are times in this work that a facilitator can be really helpful, right? Because sometimes groups get stuck, and facilitators might know some tools or some approaches that will help you kind of move from one step to the next step. But there are lots of examples where communities, work quite well together, following, a couple of processes that they can actually take their work through the stages quite well. And then you might want to bring a facilitator in when it feels like the group is getting stuck a little bit. And that, facilitation can also allow all the members in the group to have equal part in the conversation. And it doesn't have to be, like, there are lots of groups where there are people within that group that have great facilitation skills, right? So, I'm sure, Kelvin, if you looked at all the network of partners that you have around your table and you said to them, like, we really would like to have someone help us facilitate the next session, they could probably in that network of partners identify someone with facilitation skills manage it. What's, I think, really critical beyond facilitation is really thinking about, you know, what is it that is our next step, right? So to kind of plan the journey and then say, okay, so what's the next step for us? And what do we need? What are the type of questions we need to ask? What's the type of information that we need to have to make this process go forward more effectively? And then how can we enable that, whichever way we look to enable it?
Yeah, and if I could jump in at this point, what we found in our experience was that we needed a lot of time to build relationships. We needed a lot of time to have conversations. We did, you know, it didn't just kind of hit us when we got together that, hey, you know, there is a common agenda we can work on. It took a lot of talking. It took a lot of time, you know, just to talk about what's happening in the community before we arrived at some of the common pain points that we, you know, probably felt more confident sharing, because, you know, it's very hard to let other people know what we're not doing well in, you know, but, and that was something we needed to come to a point where we felt comfortable talking to one another about, and what were some of the challenges, not just with the issues in the community, but also some of the challenges we feel in moving resources internally and engaging people, you know, even the clients. A lot of it is about doing that, and not just within the core planning team, but even with the larger community where we had to engage the residents. Because if we can get to a point where the residents come on board, I think we've got you know, a lot of the issues solved, where we get to hear their voice, where we get to work with them on a complex issue like dementia. Yeah, so this is something that, and we had to, I guess, start from the areas of strength that each organization was already in. So we had organizations who were focused on dementia that talked about how, you know, how they were engaging the residents, their clients, and then we went on from there, and we took reference from these different areas of strength, and then we see how we could build on these strengths. It wasn't easy because, as I've said, you know, the ecosystem in Singapore is such that we've all got different KPIs for organizations. It's probably not unlike what you face in Canada. And we had to see how we could convince management and board to allow us to spend time building these partnerships. Because, you know, we've worked collaborations to death, I think, to a point where people are starting to tire, they're fatigued. Because, you know, while I want to collaborate, I've still got my own key performance indicators to achieve. I've still got my own work in my own backyard. How will helping you help me?
Yes, Kevin, certainly I think that is an important point, which is I want to delve a bit on this, and I want to bring this back to Paul. I remember you sharing this session that you have facilitated, where you asked different people you ask them what they want to bring to the table. Mm-hmm. What do they want to change? And perhaps you want to share a bit about that, because there are quite a number of questions on consensus building. How do we reach a point where we can have a commitment on the issue at hand and what we can do together, each and every agency? Yeah.
Well, I think, I mean, in some ways, every community is different. I'm just looking at a comment here from Cynthia K. Just saying that in Singapore, you're more conservative and you don't really express your opinion maybe the same way we do, or as easily as we do in Canada. I don't know. I mean, I know that in Canada we have that problem too. It's not really a problem, but you know, my sense is if we were a collaborative already in our community, I would do two things. One is I would start to learn about collective impact, but to do it together. So if there's already 10 agencies working together, form a learning circle and start to learn about collective impact. That will help you to communicate in a very real way. The second thing I would do is what Kelvin suggests, is that we need to talk to the residents. We need to talk to the people that we're trying to help. And it's interestingly, what we have found in Canada, we're not very good at asking the people we're trying to help what they want and need, right? And we're even worse at asking them for their help in creating the kind of activities that need to be done, right? And I think what happens is when we begin to learn what residents need, what our clients need, and we hear from them, we begin to change. But then eventually, as we're learning about collective impact, and the story you're thinking about, Weipeng, is when I was facilitating this group that was talking about this work, one of the members of the group said, I get it. I'll give you half a staff person and $10,000 because that's my spending limit. And he looked to the person next to him and said, and you? And by the time we finished that meeting, we raised about $200,000, and about the equivalent of 3 staff had been given as volunteers to this process. And I think ultimately it's like that. It's like, and that's what we mean by asset-based, right? When you start to think about what we all already have going for us. Liz was talking about all the great facilitators that are already within our networks. We have the clients that have all kinds of skills. You know, for every problem a client has, they probably have about 10 assets or skills that they could contribute. But we only look at the problem and we want to solve that. So we start to bring the families together. We start to bring the different organizations together. We start to bring the businesses from that neighborhood together. You see how we start to build a network. And the talking, it doesn't have to be just about theory, right? It can be very practical about, you know, how do we make things better? I always think my favorite questions in a conversation are, number one, why is it important that I'm here today? Just to say, why is this issue important to you? What's happening now? That's my second question. If everybody can talk about what's happening now, right? What's their take on the problem and the solution? The third question is, what's the change that we want to see? And the fourth question is, what could we do together? Those to me are the magic questions of a conversation, and they will lead us down a wonderful path.
I think just building on what Paul has just said, you know, really why I really like collective impact, but I think it's sometimes not fully embraced, is the mapping of the ecosystem, right? So for example, if you're wanting to work in the area of dementia and change the outcomes for clients and their families who have dementia, you want to look at who's already delivering services in this ecosystem. So Paul, that leans into what are the assets that we already have, and where is some of that maybe duplication of services, duplication of delivery potentially. And collective impact allows us, if we're willing to have open and honest conversations, to say, hey, maybe we have too much of this and not enough of this, and really begin to identify those opportunities within a community, a neighborhood, which can lead to better outcomes for the folks that we're looking to improve outcomes for. And I think that that's kind of really important in collective impact. The other thing that I think is really important, and is part of what I saw in some of the questions that were posed, I think it's important for everybody around the table, and this links into Paul's question about why is it important that I'm here. I might add, how is the mission of my organization aligned with what the shared work is that we're going to try to do, that shared change? And when you can get that alignment, when you can see, you know, that this charity, the Catholic charity, aligns with, you know, improving the lives of seniors, and Kelvin's organization aligns with it, and Tamarack aligns with it, that's where you're going to move from buy-in that, yes, this is a good idea, to ownership, right? That we actually have a stake in these outcomes that we're trying to envision together. And my role is as important as every other person's role around the table.
Okay, thanks, Liz. And here's another question, and I'd like the three of you to give quick takes on this. Now, different agencies involved in a collective impact, in the beginning, they may be receiving funding to do certain things in the community. So they have stakes and interests already, and it's not a blank slate, right? So they come into a collective with their own interests, funded to do certain things. And so when we talk about working together, there are, in a way, certain extent, some of their stakes could be of concern, in a sense. The interests there could be conflicting interests. So how do we get over that to look at the larger agenda, what the community really needs? Now, the point that you make, Liz, about duplication of services. So it means that either I do less, you do more, or I do something else. So that kind of difficult conversation, how do we get that going? That's one. Secondly, is there a role for funders? How can funding model help to break some of these deadlocks? Just a quick take from Kevin's perspective, Paul and Liz.
So from my perspective, it's probably not the conversation you have first. It's a conversation that you first want to kind of think about what is the problem that we're trying to solve or the opportunity that we're trying to lean into. And then you do a little bit of that kind of mapping of the ecosystem. I think, the reality is that these kinds of conversations, collectively, we want to change things, right? And, the intent of everyone, I think, around the table is that we're coming together for the right reasons, right? To make some shifts so that we will get better outcomes for the community that we're serving and the individuals in the community that we're serving. And so I think that if you go into it with that spirit and that intent, it really does then help you kind of say, okay, so if that's the case and we're going to work on this issue together, health and well-being of seniors, then it really actually does ask us to say, okay, so who's doing what already around health and well-being of seniors? Where are the strengths and the capacities that we can leverage in our community? And where are some of those things that might be, either gaps in the community that don't exist right now, or the community is being overserved, right? And I think that with collective impact, that's the promise of collective impact, is to say, in order to get to the population level outcomes, because that's really what we're trying to achieve. Not poor, in Tamarac's case, not poor people who are better off. It's actually net less poor, right? So we're looking at that population level impact. If we're truly trying to do that, we want to use our resources to the best that we can to get to that population level change.
Yeah, Paul, Kevin, any one of you? In response to my question?
I don't have anything to add beyond what Liz did. I thought that was a good answer.
Yep, agree. And Kevin, maybe from your perspective, involved in this project, what worked and what didn't work?
Yeah, I concur with Liz. It's really about finding that issue that we want to address. What is the common pain point? What's the problem that we had that we wanted to come together to solve? Like I said, it took a lot of time, a lot of conversations, but in that process, it was crucial because we wanted to build trust. And yes, I know that we're all funded to do different things, and you won't be able to get, like we had 24 organizations come along for our partnership meetings, but not all 24 are involved in a project around dementia. Okay, so we started off with the ones that were keen, that were interested. And I've realized that once that trust was built and the relationship was there, people started coming up with solutions. They started coming up with suggestions because they wanted to become a part of it. And somehow they would be able to use the assets, the resources they had along the way. We've got our nursing home partner who, because of the nature of their work and because it's center-based, really wasn't in a position to be too much involved in, community-based activities. But they were suggesting the possibility of being a holding center for people who are found in the community with dementia who might be wandering, because not many of us have that capacity or the staff to fulfill this function. So this was something that we explored, and this is something that we're going to perhaps roll out later on in the pipeline. But it is working from the areas of strength. It is about looking at where they can come in along the continuum. But firstly, starting off with those of us who could, those of us who want to, and then slowly, you know, just bringing along people on that journey, more residents, more partners, so that it becomes a movement. It becomes something that will continue to generate interest and be sustainable. I mean, to the point where perhaps some of us may later exit to focus on other areas, but then it goes on because it's rooted, it's anchored in the community, not just by the service providers, but also by the residents.
Okay, thank you, Kevin. This is a relatively straightforward question. Some of the participants asked, is 12 months realistic? This is in response to Paul's, 12 months, first 12 months.
I like to say 12 months because it gives you a full cycle of a year. But, many organizations, it takes 18 to 24. It's just very hard to have the startup phase last so long. People get tired of startup. There's a lot of pressure to get to action. And even though you build action into the startup, they want their plan and they want to launch the collective. They want to launch the work, the campaign. So yes, it can take longer, but we're finding that if you look at the preconditions of success, and if there is a real long history of collaborating on that issue, it does go a lot faster. But if there isn't a history of collaboration, and if that issue is not a priority, it takes time to build momentum around the issue. It takes time to build trust in the collaborative, right? And it takes time to convince funders to fund differently. So for that reason, if the issue isn't highly visible, if there isn't a strong history of collaboration, and if funders are entrenched, it's going to take longer. Because all of that needs to loosen up and tighten up in order for us to move forward. But, a lot of communities now, there's been a long history of collaboration. And I'd be interested to hear, in Kelvin's community, they've already got this big experience of collaboration. So if they bring more collaboration and more collective impact into that community, people already know what to do.
Right. Thanks, Paul. So would you even go further to say that actually collaboration, an existing group of people that are already collaborating, is a prerequisite to an effective collective impact?
I wouldn't say it's a prerequisite, because sometimes Weepeng, as you know, it's actually a deficit because they can't get out of their way of being, right? I remember in one community, we asked the 22 agencies working in that neighborhood, would they each give $1,000 to the resident-led collaborative, right? And join that collaborative, and only one did.
Okay,
so
I got a point.
They were very entrenched in their way. They weren't going to give up even $1,000 to the resident-led group.
Okay.
So at that point, I threw up my hands and said, there's not even any use trying to help you guys here. If you're not even going to recognize the residents to that degree, because you know better, you're the professionals, right? They were entrenched. So sometimes the collaboration it works. I find that the best way to kind of get people thinking differently is to form a learning group. Even if it's only 2 months long, meet every week for 8 weeks and learn about collective impact. Read about it, talk about it, come to webinars like this, watch them together, discuss them. That breaks a lot of the old ways of thinking, especially when we start thinking about, systems change, and we start thinking about shifts that we want to have occur. And we talk about how entrenched we are in terms of how we deliver. When we talk about lived experience and the voices of residents in how we're going to do things, we start to change quite quickly at that point. And then we'll know, are we willing to break out of our silo and work together in a way that we will have. Don't think about it. I just want Singapore to learn what we made a mistake. We started calling collective impact, it was a thing in itself. So we got to do it the collective impact way. That's not what collective impact is. Collective impact. All of us together have a bigger impact. Many hands make light work, right? Many hands make light work. We're working together. And when we work together, we're going to have a collective impact. It's not you don't learn collective impact, you do collective impact. Does that make sense?
Yes, absolutely, Paul. And it is a process. Definitely can't be done within 12 months unless it is already a functioning group that work very closely with each other, probably on a very clear issue. To what extent is
if the funders are committed as well?
Right.
You know, we need to work with that. I know we're going to start meeting with more funders through this process, and there's lots of questions here about funders and about the entrenched government. And welcome to Canada. It almost sounds like it's a repeat performance. A lot of the issues you're facing, we've already faced.
Right.
Yes.
If I could jump in on a point. I know it's often said that we need to begin with the end in mind. And I think we need to take that in perhaps a different context sometimes, where we know where we want to get to. Like, for example, in Amokyo, where we started working on these projects to support people living with dementia, we did that on a organizational basis. You know, so we all knew where we were, what we were doing, and where we were going, but we didn't come together to do it together. We started slowly, kind of exploring each other's assets, resources, and where we were going before we came together to say, hey, is there a way we could leverage on each other's resources, you know, and then kind of do things a little bit more collaboratively, and then build on that. And then now we are at this point where we are putting together this partnership in building an inclusive and dementia-friendly communities, and getting more people on board, getting a framework put in, getting funding from the different organizations. So it was a process of building on a movement. It was a process of building on what we would now call, or what you would call a collective impact.
Yeah.
You know.
Thank you, Kevin. And we have come to 10:30. That's the end of the webinar that we have. Booked everybody's time. Yes.
One of the things we could do is I think Rute can capture a lot of these questions, and maybe Liz and I could spend some time sending emails to people and answering them online back to them.
That would be great, Paul and Liz and Kevin. There are some questions for you as well. We hope to get your response. So before I end the webinar, I just want to do a shout out on NCSS interest in catalyzing collective impact. If you have an issue that you think is critical, compelling enough for you to put in the effort to organize, the actors into a collective, please let us know. NCSS, you can email to me, and we will be very happy to get in touch with you. I mean, having webinar like this is just part of the process. It's enabling it, but we need to learn how to fund collective impact, how to connect people, connect actors, and those are the two other things that we need to do. And we'll be happy to talk to you, and just reach out to me. All right. So with that, just want to let all of you know that you will be automatically be included into Gather Here, a learning platform by SSI. It works somehow like Facebook, and we are trying to create a online learning community so that we can learn together in this process and share information. And Liz, Paul will share resources from Tamarack. So they are very kind to help us going to build up this library of resources. So I look forward to your participation in the online space as well. Okay, so with that, this has been a very fruitful morning for myself, and I hope it is for you and the speakers. And I'd like to thank you. Please sign up for the next 3 webinars. They are coming on, and they build on each. You know, the webinars is built on each other. So please join us. So thank you very much, Paul, Lise, and Kelvin, for this wonderful morning. Thank you.
That's great. And we'll send out some invites directly to everyone that attended. So fantastic. Okay. Good job, Weipeng. Thanks, Kelvin. Thanks, Liz. A great evening. It's 10:30 here. It's our bedtime. And you have a good day.
Yeah, you have a good night. Good night.
Good night.
Bye-bye.